intensive care. 191 people have now recovered, and in total we have tested 6,249 people. The small number of new COVID cases in our province over the last few days is certainly encouraging, but we must remain strong and resolute in our efforts to suppress the virus. We must not let our guards down. As long as COVID-19 is still in our communities, an outbreak can occur at any time, and we must continue to do our very best to avoid a resurgence in cases. What happens next is up to each and every one of us. Please continue to do your part. Keep your physical distance from others outside of your bubble. Stay at home unless you have to go out for essentials. Wash your hands often and well, and stay at home if you feel unwell, and practice proper cough and sneeze etiquette. These actions are making a significant difference, and I thank you. Today, I'd like to remind residents that we have broadened our testing criteria for COVID-19 in our province. Anyone who now presents with 2 or more of the following symptoms will be tested for the virus. Those symptoms are fever or signs of a fever, which include chills, sweats, muscle aches, and lightheadedness, cough, headache, sore throat, and runny nose. If public health officials recommend that you be tested, you will be required to self-isolate. If your test result is negative, you will still be required to continue self-isolating until 24 hours after your symptoms have resolved. If your test is positive, you will have to continue to self-isolate, and public health officials in your region will contact you for advice and follow-up. You can access your test results through the online portal located at gov.nl.ca/COVID-19. Please note that it can take up to 5 days for your test result to be available. Yesterday marked the beginning of National Volunteer Week in Canada, and this year's theme is "It's time to applaud this country's volunteers." I think we would all agree that the timing and theme of this week could not be more appropriate. Newfoundlanders and Labradorians are well known for their generosity, selflessness, and commitment to rallying around people in our communities in need of help and support. And we are fortunate to have thousands of dedicated volunteers in our province who do this year-round. This commitment and generosity is always heightened during difficult times, which has certainly been demonstrated during the COVID-19 pandemic. I am deeply inspired by our many volunteers who are working closely with community organizations to support our most vulnerable populations, volunteering daily at homeless shelters and food banks, and delivering food, essential items, and medications to residents who would otherwise do without. For your kindness and generosity, please accept my sincere appreciation and thanks. Your contributions are invaluable, and we cannot do this without you. As a recap for those who may have just joined us, we have no new cases since yesterday's media advisory. The total number of cases in the province is 257. By health region, we have 239 cases in Eastern Health, 8 in Central Health, 4 in Western Health, and 6 in Labrador-Grenville Health. COVID-19 has certainly challenged us and tested our strength, but it has not and will not break our spirit and determination. As long as we remain united together and steadfast in our efforts, we will weather this storm and look forward to better and brighter days ahead. Thanks.
Well, thank you, Dr. Fizgerald, and I too want to recognize the great work of volunteers across Newfoundland and Labrador. We have many thousands of people in every single region, in every single community, people of all ages that have contributed, many for over a lifetime. I'm always amazed when I visit communities, and when I used to visit communities on a more regular basis for public events and so on, to see the large number of volunteers and appreciation, awards and recognitions that we would pass out to some people who have been volunteering for 40, in some cases 50 years within our province. So like Dr. Fizgerald, I too want to recognize the work that you're doing, especially during this health crisis in our province, but also for the work that you've done in the past, and I'm sure you'll continue to do as you contribute to Newfoundland and Labrador. Based on today's update, I guess many of you would be thinking, well, there's no new active cases in the last 2 days. Sure, we could ease up on things. Well, of course, the answer to that is no. Now is not the time. You just simply cannot start to relax your actions. Although this has been the result of the last 2 days, we must also be reminded that over the last week we have had 13 active cases. So this is not a time to let up. As Dr. Fizgerald said, we must prevent a resurgence. What this result tells us over the last couple of days is that the things that you are doing, they're working, and you're doing a good job in following the guidelines. So we want to thank you for your efforts. They're making a difference, but we still have a ways to go. So let's be patient, and we will be successful. The health guidelines that we've put in place has to remain your top priority. But as I recognize the work of our volunteers just a few minutes ago, I also want to thank the All-Party Committee for the continued support during this health crisis. We continue to meet daily. We talk about many things that we talk about as we, through these media briefings that we do every day, things like testing, travel throughout our province, PPE. We have detailed meetings every day, and I want to today send out my thanks to the All-Party Committee for the work that we're doing. But we all know that we're still in a public health state of emergency, and that your actions today will determine what this virus looks like tomorrow. And if you take it a step further, your actions today determines who this virus will affect tomorrow and into the future. So what we need is for everyone to continue to be responsible and be safe. We are seeing people at this time limiting, and we appreciate this, they're limiting their shopping for essentials just once a week. This is what we've been asking you to do. Many of you are ordering online and utilizing curbside pickups. And we've seen some great examples of families working together, compiling their lists to cut down on the amount of people going out to our stores. If possible, do not take your children. Just go with one person per family. And we also understand, however, that not everyone is in a similar circumstance, and everyone's circumstance could be very different, and not everyone is able to do exactly or limit this to exactly one person. But we ask you, and we please continue to try to keep your numbers down. It's like the old saying that says that less is more. In this particular case, less is more, and less is safer. And we want to reinforce to everyone again today that it is essential travel only. But also what is essential is taking care of yourself, taking care of your mental health. And if you are feeling stressed or you're anxious today, just remember that we have resources that are available to support you. Visit Bridge the Gap, and this gap with GAPP.ca. And this is where you'll find the resources for both adults and for our youth in our province. We want to support you and your mental wellness. You are not alone, and we are here to support you. It is about working together to stay apart, to keep everyone safe during COVID-19. In addition to listening to our daily briefings, we ask you to continue to visit our website. This is where you'll find the most updated and trustworthy information, and it changes really on a daily basis. There's a good breakdown of the supports and services that are available to you. We must also stay connected with family and friends. Again, by picking up the phone, I want to appreciate the number of responses that I've gotten from people now are just going back to using the phone and saying hello to friends that they would have known years ago, and staying connected virtually as well. What we all have to realize is that this is the only way that truly we're going to get through this, is to stay physically apart. We can stay and should continue to stay socially connected. As a province, we have faced adversity. It's about our history. We've seen many examples of adversity in the past. But this is where we as Newfoundlanders and Labradorians shine. So again, let's flatten the curve together. So thank you for this opportunity. I now pass it over to Minister Haggie for a few comments.
Last night, I had a conversation with my friend and colleague, Randy Delory, who is the Minister of Health out there in Nova Scotia, and it's been an awful day. Not only was the tragedy in Portapique awful, but he saw an increase of cases with COVID-19 and deaths in long-term care facilities. And he'd had a very stressful day. We shared some reminiscences. Each of us has family members, family friends rather, who were law enforcement officers who died in the line of duty, and it was quite an emotional exchange. With regards to today's news, it is good. The numbers are reassuring. But again, I can only echo what Dr. Fizgerald has said about holding the line. One of the things that has been asked of me is about the numbers of people who have recovered in the province by region. And for an update, we have 191 of those across the province, 181 in Eastern, 3 in Central, 1 in Western, and 6 in Labrador-Grenfell. We've also been asked as a department to provide a breakdown of those figures by community in the same way we provide a cumulative total. Discussions, though, with staff show that some mental arithmetic and some local knowledge would then enable people to be identified. So we do not propose to break these recovered figures down any further on the basis of patient confidentiality. With regards to testing, whilst we have seen no new cases, we have seen a significant increase in testing. Certainly on Friday and Saturday, we had some of our best days ever in terms of the number of individuals tested. That dropped off yesterday, and I suspect, quite frankly, the awful weather kept people indoors. But I would encourage anybody who has 2 of the symptoms described or has developed them despite having called 811 previously to seek advice about getting tested. The criteria have changed within the last 5 days, 6 days, and it may well be that a person who was not eligible before may now be so. And I would encourage you to get that done. With regards to what happens next, again, that will depend on several things, not least of which will be the amount of application and diligence that we can maintain with the recommendations that Dr. Fitzgerald has put forward. I referenced last week some of the changes that we had made in reducing the risk to our seniors by restricting further interchange of staff between long-term care facilities and between long-term care, personal care facilities and community jobs. That has presented some challenges in a couple of locations for regional health authorities, but we've worked through these. There are some changes for Bell Island, and I've discussed them with the local MHA. There are changes in St. Lawrence, which have been put in place in the light of an identified case in that facility. And because of the challenges about staff moving back into the changes that we put in place as a result of that, will have to remain in place for the state of emergency. With regards to personal care homes, we have not been advised of any staffing challenges directly through the associations that represent personal care home operators, but we continue to work with them to make sure that that remains the case. I do know that community care homes have been challenged, and we're working with them individually and collectively to try and deal with those. Our main area of concern now is around home support, and 40% of individuals receiving home support do so through what's called self-managed care, and these individuals have support workers that come in on a basis that we haven't been able to ascertain the amount of interchange between them and others. So we're working through the case managers to try and resolve that. As regards personal protective equipment, that is an area of concern. But in line with Premier's and Dr. Fitzgerald's comments about Volunteer Week, I'd like to use this opportunity to thank Bell Alliance for a very generous donation of N95 masks, which will certainly go a ways to helping out in this time of challenge. It's our area of weakness, but as I've said before, we're still managing to bring in sufficient supply to replace each day's usage at the moment, and we'll continue to keep an eye on that. Again, We have done well as a province. If you look at Google and their statistics about mobility, which they take from their tracking app, we've seen significant reductions in this province about movement around related to business and retail. And I would encourage everyone that we need to continue to hold the line. Whatever we do with this disease has a 14-day lag period. It is too soon to say that several days of low numbers mean we've beaten it. We need to wait this out to find out how we then can transition to what will, quite frankly, be a new abnormal rather than a return to the old normal. So again, create that bubble, stay in your bubble, and don't burst anyone else's. And with some more diligence and application, I think we will be able to get through this in a way that brings us into a different normal. So with those comments, Premier, I'd hand it back to you.
Thank you, Minister Haggie. And I now turn it over to the media for questions.
Thank you, Premier. For the benefit of our speakers, we have 7 reporters registered for today's call. In the essence of time, for today, each reporter will have the opportunity to ask 2 questions and 1 follow-up. We suggest that you not ask rumor-based questions. The purpose of these briefings is to address COVID-19 issues. All other government-related issues should be directed to the appropriate department or agency for response. Reporters will ask questions in the order they were registered for today's call. We will run through the telephone queue, and I will call each reporter by name to ask questions. Please do not press star 1 until your name has been called. Following this, should time permit, reporters will be individually asked for single questions. This call will end at 2:59 p.m., and further questions can be emailed. Our first questions today are from Peter Cowan of CBC News. Please go ahead.
You said the numbers show that it's not the time to start lifting the restrictions. What benchmark are you going to be using to decide when that is?
So there are several benchmarks that have to be used and several indicators that have to be used to make that determination. And that's certainly something that we are looking at right now. But first and foremost, there has to be a period of time of slowed growth before we can even consider doing anything. So at the moment, we are looking through what those indicators would be and what that would mean for Newfoundland and Labrador. And when we have more information on that, certainly we will be sharing.
When you say slowed growth, though, wouldn't several days with either single digits or in the last couple days 0 cases not qualify as slowed growth?
It's certainly slower than what it has been before. However, as Minister Haggie just said, this incubation period is up to 2 weeks. So we really do have to look at this in a longer term than just a couple of days.
Peter, if I may build on what Dr. Fizgerald has said, the fact is that other jurisdictions, when they're looking at this, are using periods of anywhere as a minimum of 14 days. Some of them are suggesting no new cases. Some of them are suggesting new cases at a rate that the healthcare system can manage. And others are even suggesting longer periods. So it is a moving target. In the light of developments elsewhere, we'll be better placed to make that determination. The challenges really are around what order one would consider reopening things. And there is work being done on that to help advisors. And really, there's a lot of models that are actually built in lab experiments across the globe now. So you could take a look at what Denmark's doing or what Germany's doing and see where they go right and where they go wrong. The one thing that is certain in everyone's mind is that when you relax these, you will see new cases. The question is when and how many.
So, Peter, if I could just make one comment on that as well. I know everyone's getting a little anxious and they want to see things, open up, or at least some people do. We receive those calls as well about what those benchmarks would look like. But I think a gentle reminder of that we had our first case of COVID-19 test positive in Newfoundland and Labrador, and that was on March the 14th. So that's literally, not even 5 weeks ago. So. And we're up to 257 confirmed cases. So it is very sensitive. And we just just remind people, let's continue to be patient, continue to be disciplined as we work our way through this and out of this in a safe way.
I want to ask a question about education. We had the health minister here a couple weeks ago. I'm hearing from parents that for some classes there's still been no online learning. There were plans to get technology out to students who may not normally have access to it. What is the plan to get some sort of education back up and running?
Yeah, so there's continuing education. What we've been able to do, I think, this week is we're anticipating that some of the final marks will be out around April the 22nd. And so I think we're still on target from what I know, given the updates that I've been getting from the Department of Education. We had some information that came in today. I know that they're still working with our students and identifying where the problem areas would be. There's minimum amount of problem areas, but we're working with providing the technology to those students that would want that. Also, from a more paper-based driven, we're getting information out to students that were required in that aspect as well. So there's a number of initiatives that's ongoing as we do the look around the province and try and identify where the gaps would be. So recognizing that this is about continuing learning for the complete of the school year, and the teachers and the students, are working together to make sure that they can actually, in some cases, prepare for next year, and in some cases, those students will prepare for graduation. So the mark on April the 22nd will not be will be the mark that would be guaranteed, but students, can raise that mark with some extra effort between now and the end of the school year.
Our next questions are from Kellyanne Roberts of NTV News. Please go ahead. Kellyanne, please press star 1.
Please press star 1 at this time.
We'll move on to reporter number 3. We'll come back to Kellyanne. Our next questions are from Ben Murphy of VOCM News. Please go ahead.
Thank you. And I do know Kellyanne is definitely on the line, still trying to get through. I think she just has star 1 issues. But Dr. Fizgerald, last week you said false negatives weren't really a big problem here right now as we are testing those symptoms. BC's Officer of Public Health has said false negative rates can be as high as 30% early on in infection. Has information on false negatives here changed at all in the last week?
No, so false negatives, as I've explained before, false negatives can be as a result of several different things. The test itself, when it is tested against controls, is actually quite effective and quite sensitive and what we call specific. So if you have COVID, it is quite good at detecting it. The problem with some of this testing is that, people shed the virus in different ways. So if we test too early, then they may not be shedding enough virus to detect. If they're further along in their disease, then the virus may not be up in their nose right now. It may actually be down in their lungs, and so we need a sputum sample as opposed to a nasopharyngeal sample. So all of these things can affect the overall sensitivity of the test. So that's why we have to make sure that we're doing the test at the right time and we're doing it in the right way. And, all of this we're learning as the disease, our information about the disease evolves. But certainly right now, if you're in the early stages with milder symptoms, which are the people that we're trying to detect now with our new criteria, then certainly doing a nasopharyngeal swab is an effective way to detect COVID-19.
Okay. And Minister Haggie last week spoke quite a bit about those people who have pushed off other medical needs like elective surgeries, et cetera. I've heard from some people who are not able to actually get in contact with their doctors lately, and they're left not really knowing what to do right now. Do you have any advice for these people who might be in this situation, like a number to call or something?
Certainly, the issue has been addressed by both the regional health authorities and the College of Physicians and Surgeons. It is expected that a physician would have a number where either they can be contacted directly or a member of their office staff will take messages and arrange for a return call. My understanding is, as you, that there are still people who have had challenges in contacting their physicians. It is expected, however, as a condition, if you like, from the College of Physicians and Surgeons. They were very forthright in their April 14th statement that they expect physicians to make themselves available. And I would suggest that if this is a more prevalent issue than just the odd one or two, we could certainly put a number in place. But the Regional Health Authority, client relations, for example, would be an alternative for those people employed by the Regional Health Authority, should they not be able to get a satisfactory call back from their primary care provider, for example, or their specialist at a facility. We'll certainly look into that if there are greater numbers. If you have any specific individuals who are having that problem, then by all means let me know.
Okay, great. Thank you. And Premier, I'm hearing from lots of substitute teachers who feel that they're being ignored by the NLTA, NLESD, and government, as many are stuck with no income. They're not getting paid. Yes, the CERB is good for some, but not for many. What do you say to some of these substitute teachers out there who just don't know what to do?
Well, right now there's part of the budgeting process for the provincial government. There's been a budget allowance for substitute teachers. We're also have been reaching out to some of the work that we will do with childcare spaces, and see what the substitute teachers are able to do with that. Keep in mind that the program that we put in place for childcare is up to the age of 13, and so there's an example there that we could actually work with the substitute teachers that are available within the system to get them some hours. And so then there's, we're working very closely with the NLTA as well, with the Department of Education and Early Childhood Development, in recognition that that some of the substitute teachers that would currently be getting some hours right now are not getting that. So we're aware of this program, we're aware of this situation.
Thanks.
We'll go back to Kellyanne Roberts of NTV News. Please press star 1. I've been informed that Kellyanne is going to have to hang up and call back. So if you would do that, Kellyanne, that would be great. And I'll go on to the next reporter and then come back to you. Our next questions are from Marie Isabelle Rochon of Radio Canada. Please go ahead.
Based on the fact that there are few cases in some regions of Newfoundland and Labrador, is the government thinking of allowing reopening of business in some part of the province? Is it a scenario the province is thinking about right now?
Well, for opening up the economy, it's very difficult to be able to pick it, community by community, region by region, and so what you do is, when you're in a position to think about those things, which clearly right now we still focus on the health situation that we're dealing with. And so, if when we get to a situation where we're actually thinking about reopening, we will do this on a provincial basis. I mean, keep in mind it's a small population. People move back and forth. So what we do in one region does not necessarily mean that if there was a mistake made in one area, that would not expose a significant portion of the province in another area. So right now, any opportunities that we're looking at to reopen the province, we would do so on a provincial basis.
Perfect. The Fish Harvesting Safety Association has released a safety protocol for the industry. Some harvesters still say these protocols are still way too impractical for their working environment. I was wondering, Dr. Fizgerald, could you maybe comment on those measures, and do you feel they're safe for harvesters to go work with this protocol?
So we have given advice to harvesters with regard to what we would consider to be a safe operating environment with regard to COVID-19. Obviously, I am not an expert in fish harvesting, and so I have to rely that people can take those guidelines and apply them to their particular situation. So we have provided those guidelines, and then people will have to take them and apply them as best they can to their individual situations.
Okay. And my last question, based on the number of new cases we see over the last week, how likely are the scenarios that were presented by the province before Easter weekend, how likely are they to actually happen?
That's a very good question. I think what you really need to do, and I think Dr. Rahman and his team were very keen to emphasize that point, is these were educated models based on data that they were concerned about in terms of numbers and the fact that we did have one big cluster that may or may not have skewed things. What we did say and what will be happening in the very near future is that with the new data we've got in the last 10 days, we will get Dr. Rahman's team to look at those models again, and we'll be in a position, hopefully in the next day or so, to see and advise people whether or not the model, the projection has changed, and if so, in what way. I think I could be fairly confident in saying it won't be the same as it was 10 days ago, but exactly how that will change. You're looking through a crystal ball, and it's not very crystal clear, and it's really hard to use these in any other way except the general planning tool. So we'll see what the next one looks like.
I'm told Kellyanne Roberts is back on the line. So Kellyanne, if you would go ahead, please.
I don't know what happened with technology on Mondays, but anyways. Premier, wondering if you can make comment on OceanX not receiving any federal money.
So, OceanX, would be able to apply for the federal programs, and there's a significant number of those that would apply to companies like OceanX. In particular case, something very specific or unique to the OceanX situation is, as last week we had discussions around food security for Newfoundland and Labrador, and based on the feedback that we've been getting, the use of Marine Atlantic, the use of the trucking industry, and some other options that might come up into the future. Right now, as a province, my concern was one-off food security. And so right now, given the level of interest and how others have stepped up and speaking to many people on this very issue, is that they feel that there's no need to worry about the availability of food for Newfoundlanders and Labradorians. And OceanX, even though we want to make sure that every single Newfoundland and Labrador company has the opportunity to be successful coming out of this, OceanX has been an active player in Newfoundland and Labrador. We appreciate the work that they've been able to do in supplying goods and services to our province. And what I understand now, they're looking at ways within their organization to reduce the number of trips from one a week from Montreal to St. John's and one a week from Halifax to St. John's. And so it's really a reduction in services right now by OceanX. It's not cancellation or suspending them. It's a reduction of services as they look for ways to save costs and continue in the future to be successful.
Thank you. And we know that the cluster that broke out there, makes up for a majority of the cases in the province. I'm wondering if we've been able to identify the second biggest way that this disease has moved through the province.
So clusters, certainly the biggest number of people has been with the funeral home cluster, have been able to be traced back to that. And then travel-related exposures are our next highest exposure criteria. Or category, sorry.
Hearing from several social workers, they're wondering what's being done for them when they have to do welfare checks and emergency visits to homes.
So you're talking about initiatives or plans that were in place for social workers?
If there's anything new going forward.
Yeah, and so we're still working now. We know that there's a number of, as an example, children in care. You work with foster parents, and so right now we know there's some. We had a limited number that would require some additional supports with technology, things like cell phones or so on. So, what we're trying to do is make sure we can keep the family unit as connected as possible. Realize that this is a difficult environment right now. It's the safety of the families, the safety of the children. That's the most important thing. That's the priority for us. But also know that there's exceptions that occur from time to time, and in some cases it might require some support for things like technology. Of course, for social workers right now to go into an environment that they do not deem to be safe, that is not what we expect from many of our public sector employees right now. So safety is a concern for our employees, but also making sure that we can put in successful connections with families and support some social workers. We want to do that as well.
Thank you.
Our next questions are from Elizabeth Witt of All Newfoundland Labrador. Please go ahead.
Thank you. Minister Haggie kind of brought it up, but I was wondering if we could get any more updates regarding developments on shipments of PPE into the province.
The orders that we have placed both back in January before the pandemic, our so-called pandemic supplies, and the ones we placed subsequently, and also the ones that come through the federal government, have essentially been arriving late and light. We have got a share of the federal ones in proportion to our need, and between that and our regular orders, we have been able to keep PPE inventory levels around the same across the duration of this 5 weeks. We have at least a week's supply of everything, and with some items, we're very well blessed. But it's one of those things that's only been achieved by a lot of hard work by people in the shared services area, through Eastern Health, and through extra staff being allocated to our department. So we're no worse off now than we were 2 weeks ago.
Thank you. And we know a lot of research is now going into COVID-19, and that information is building up quite quickly. And it's now known that one of the organs the virus attacks are the kidneys. How is the province in terms of available dialysis machines?
That's an issue that we have looked at. It certainly became topical with the information, as you put out, that was coming out. Each region has emergency dialysis facilities. Traditionally, beyond a certain point, those have always gone into the kidney specialist, often attached to ICU around the Health Science Centre. I can't give you a number of available emergency dialysis machines off the top of my head, but I can certainly get it for you.
Thank you. And I think
we may have lost Elizabeth there, but Elizabeth, I'll come back to you again. Our next questions are from Peter Jackson of the Telegram. Please go ahead.
Hello.
Hey, Peter.
Hi. I wanted to go back to one of the original questions today, and that is there's an Angus Reid poll that shows 3/4 of Canadians support the current crackdown, which is, not enough, but encouraging at least. But at least half of Canadians, or close to half, want something to happen within the next month or two. And I'm wondering what you would say to someone that they're kind of being talked down to when no one is giving them even the slightest indication of how something. There's a lot of talking points about we'll look at that, we'll look at that. Why can't there be more specific talk about exactly what would happen in a given scenario?
There aren't any specific answers, Peter. We could make stuff up for you if that would help. Facts of the case are we don't tell you because we don't have a certain answer. There are no certain answers. And what we're doing is just like everybody else. We're looking at the best available evidence. We're seeing what's happened in jurisdictions that have gone before us. And we are trying to apply those lessons in any and every conceivable way to Newfoundland and Labrador. So when I talk about, issues around reopening healthcare and what order you do it in, some of those experiments are actually being done as we speak in places like Norway or Denmark or Germany. And we will base our subsequent decisions on what happens there. I think the absence of answers for the general public is not because of any desire not to tell anybody. It's simply the fact is that those questions are fundamentally not answerable in a detailed way at the moment.
Yes, thank you. And Premier, I wonder if you would consider opening the House of Assembly in a limited way, as they appear to be doing in Ottawa, to openly discuss COVID and non-COVID related issues, such as the economy.
Yeah, we've had, when you look at specific actions, Peter, this is one area we did. And we put in place we needed some legislation around lending and borrowing as well as a few other things. And we actually put in place measures working with all parties and all MHAs. And we did open the House, and we had it open for a session, got some pieces of legislation that were very important to the future of our province, and certainly more than willing to do that again. So as I mentioned last week, we have our House leaders in place. That would be Siobhan Cody for government. It would be David Brazel for the opposition party, and that would be Jim Daner, Alison Coffin, of course, that we're making decisions on behalf of the NDP party as well as the independents. So we are more than willing. We do talk about this if legislation is required. That we would need in place, especially during this time of crisis. We're more than willing to go back in. And that was one of the things that we discussed this morning with our all-party committee, is what pieces of legislation will be necessary to open the House up. So there's a few pieces right now, and when we get through the things that will require, we're more than willing to bring the House back together.
We'll now go back to Elizabeth Witt for her follow-up question. If you would press star 1, please.
Thank you. I just wanted a clarification on ventilators. I've heard that not all ventilators can be used with COVID-19 patients, so I'm wondering a bit more about that. Hello?
Sorry, I was on mute too. I'm having technology trouble on Monday. From the point of view of ventilators, we have 136 acute care ventilators, which can be used for a variety of respiratory illnesses. We have not been told that any of these are unsuitable for COVID patients. We do have other ventilators in addition to that inventory that probably would fall into that category, but at the moment our utilization of ventilators across the province is only at 13%, so we feel we have some leeway. There are other ventilators on order. I think the first order is for 20 from Thornhill in Ontario. I don't have a delivery date on those yet, but at the moment we feel, on the basis of our advice, that we have ventilators adequate to the job.
Thank you.
Our next questions are from Drew Nadan of Bay of Islands Radio. Please go ahead.
The weekend, we saw positive results in some trials with the antiviral remdesivir. With Canada being part of the Solidarity trial, has the government of Newfoundland and Labrador requested access to any of these types of medications to potentially be used within our hospitals?
My understanding is that no one yet fulfills the criteria for consideration in that particular trial. And that's a clinical decision. The mechanisms for urgent access to trials under these circumstances are known to the intensivists who would be looking for eligible patients. But the facts of the case are, my understanding is we haven't had anybody who would fulfill the trial criteria as yet.
Perfect, thank you. The second question is, on the government pandemic data hub, has there been any discussions in regard to adding the number of current and active cases per region to coincide with what we have provincially, like other provinces have done?
We can do that. Certainly, I just provided those in my opening remarks. I think the challenge would be that we would not want to go below the regional health authority currently in terms of recovered patients, simply to avoid some privacy issues. But certainly, it wouldn't be difficult to do that if there is an interest in it being provided.
Yeah, and I guess just a follow-up to that is, it's more so towards the number of active cases in the region. I think one question I've got from a lot of people is they'd like to know what's active within their community so they could assess the threat maybe at a different level.
Well, I think two things. Certainly we can supply those numbers. It's a simple matter of subtraction of data we already have out there, and that's no problem for the website. I think my other concern would be on people reading too much into that. We certainly had grave concerns about that at one stage when this was seen as the towny virus, and it isn't. And I think we would be very reluctant not to supply the information, but to suggest to people that there was anything they should read into it.
Perfect. Thank you very much.
We will now open it up to single questions, and our first question is from Peter Cowan of CBC News. Please go ahead.
By banning healthcare workers from working in multiple long-term care facilities, that means some of them are getting fewer hours, they're earning less. Since these are often some of the lowest paid positions in healthcare, what's being done to support those people?
So there are a number of programs, right? Yeah, and we're currently working on one that I mentioned last week, coming off the conference call with the Prime Minister, and this would be for people that make less than $2,500 a month. And so this was really building on some of the work that had been done through the Canadian Emergency Response Benefit Program, which was at $2,000. And this one was designed for essential workers that make less than $2,500 a month. So we would have to participate that with the province as well. But like I said last week, most health professionals, essential health professionals that we make, this would be based on a $15.63 threshold. So if you're making more than that and you worked, you could see there you'd make more than $2,500 a week. So you would not necessarily qualify. But if, Peter, to your point, if you make less hours, this is a program that we're currently looking at. And of course, the other program up to $2,000 a month is also available based on certain thresholds and criteria.
Our next question is from Kellyanne Roberts of NTV News. Please go ahead.
Thank you. I'm wondering of the active cases, if we can get an age range. I know we have a breakdown per age category, but I think April 3rd it was the lowest was 5 years old and the oldest being 91.
So we can certainly get a breakdown of that. I don't have that with me right now. The breakdown that we have is based on all of our cases to date.
So what we have what we would have is there are 63 active cases remaining in Newfoundland and Labrador. This was from a total of 257 that have been confirmed, and of course we have the 191 recovered. The minister and the chief medical officer has given some kind of a breakdown there, but of course we could break that down by age too. It's for those that would be interested.
Thank you.
Our next question is from Ben Murphy of VOCM News. Please go ahead.
Thank you. Dr. Fizgerald, I believe in Nova Scotia there have been incidents where some young people who are asymptomatic have presented with skin lesions or some kind of rash on their feet. Are we considering this as possibly another symptom for testing or any other symptoms that could possibly be linked to COVID-19?
At this point, no. That was not based on a lot of case reports. Certainly, a lot of viral infections can cause skin lesions, but this has not been a common symptom that has been reported with people with COVID-19. And if my memory serves me correctly, the people in that in the article that was referenced, I'm not even sure that they were actually tested for COVID-19. They were just assumed to have it because it was circulating in the community. So we have to be very careful about that kind of information when we get it. And certainly skin lesions have not been a common or recognized symptom of COVID-19.
Perfect. Thank you.
Our next question is from Marie Isabelle Rochon of Radio Canada. Please go ahead.
Are long-term care homes prepared? Is there enough staff, nurse, and doctor taking care of people in the nursing home and long-term care home? How do we know a situation like we're seeing in Quebec is not going to happen here in the province?
Thank you very much. That's a very good question. We have taken particular care to protect our long-term care facilities. Our current staffing levels are not jeopardized by COVID-19 or by any of the staff that we've had self-isolating. We've had a scare, as it were, in St. Lawrence, and fortunately that has been well contained and the virus has not spread. The issue, as I understand it in Quebec, is simply one of person power. They are recruiting anyone who has any kind of skill to provide some kind of care in long-term care facilities. Our long-term care facilities here are regional health authority run, and they are part of, if you like, the acute care mechanisms in that they have the same levels of oversight and that kind of thing. Personal care homes are privately run, and we've gone and had significant discussions with their operators to make sure that they're supported for personal protective equipment, but also to help them make sure they have no staffing challenges too. They have not reported any. As I say, our main area of concern from a staffing issue is in actual fact about people receiving home support in their own houses, and we're working with the agencies and case managers to see if we can make sure that those effects are minimized.
Operator, please do not end the call at 2:59. We have 3 reporters left to ask a single question. Our next reporter is Elizabeth Whitten of All Newfoundland Labrador. Please go ahead. Do we have a question from Peter Jackson of the Telegram? Please go ahead.
Hello.
We got you, Peter.
All right. I'm on speakerphone here with Tetu apparently, but I wanted to ask about rural community private ambulances. Apparently, they are really struggling for protective equipment. There are examples of them having to get it from funeral homes. There's a lot of anxiety around that. Apparently, they're not doing as well as the provincially run ambulances. What can you offer them in terms of some assurances of equipment?
That's news to me, actually, Peter. It's the first time I've heard that. We have had our staff in the department, the director and manager level, reach out to all our ambulance operators, be they community or privately run. We have kits available on request for each ambulance to enable both crew members to have PPE on call should they need it. I will be happy if you have some information directly of a specific case to take that back to my department. But this is news, and I'm quite happy to deal with it if that is the case.
Thank you.
Our next question from Drew Nadan of Bay of Islands Radio. Please go ahead. Do we have a final question from Elizabeth Whitten of All Newfoundland Labrador? Please go ahead. With no further questions, the time for questions has ended. Please join us again tomorrow at 2 p.m., 1:30 in Labrador. Thanks for tuning in.
Thank you. The conference has now ended. Please disconnect your lines at this time, and thank you for your participation.